My name's Steve Nicholls. I'm Professor of Cardiology at Monash University in Melbourne, Australia, and the Director of the Victorian Heart Institute. ANGPTL3 plays a really important role in lipid metabolism. It inhibits a factor called lipoprotein lipase that breaks down triglyceride-rich lipoproteins. We know from genetic studies that people who have less ANGPTL3 tend to have more lipoprotein lipase, their triglyceride levels are lower, in fact their LDL cholesterol levels are lower, and what we see in the genetic studies is that they're at a lower risk of having cardiovascular events. So there's a lot of interest in developing therapeutics that inhibit ANGPTL3. CRISPR-Cas9 is a technology that's evolved really quickly, won the Nobel Prize a few years ago. It's fundamentally gene editing. And what it enables us to do is to deliver a specific therapeutic into the hepatocyte, where we go into and find the specific gene of interest and find one specific base pair where we can make a very targeted permanent change in that gene at that specific site, leading to a reduction in protein production. So in this case, what we want to do is target the ANGPTL3 gene, leads to a permanent reduction in ANGPTL3 production. And what's really exciting about CRISPR-Cas9 technology is it has the potential to be a one and done, once in a lifetime treatment. We presented the findings here of a phase 1 clinical trial. It was 15 participants. They could either have high cholesterol or high triglyceride levels to get in. Baseline LDL cholesterol was about 155, triglycerides 192 milligrams per deciliter. They received a single infusion of this agent at different doses ranging from 0.1 to 0.8 milligrams per kilogram. And then we looked at primarily safety, but also we looked at biochemical results in terms of reduction in LDL cholesterol and triglycerides. Well, the first thing we found was that it was very well tolerated. We saw a few infusion reactions, but we could temporarily pause the infusion, give some medications, and then continue with the infusion. So that was really good. We saw a good knockdown of ANGPTL3, and that resulted in a reduction in LDL cholesterol by about 50% and triglyceride levels by about 55%. We see those changes emerge within 2 to 4 weeks, which is really good. And then what we've seen so far in a relatively small and short study is then the durability of that effect. The longer we've followed those people, the results have just persisted. Now, what we'll do is go on and do bigger and longer studies and try to understand, can this truly be the once-in-a-lifetime therapeutic that we would all hope it would be? The take-home messages are: 1, gene editing is here. We can now effectively treat cholesterol and triglyceride with therapies targeting ANGPTL3, and there will be others that will be coming into the clinical development kind of landscape. The next stage here is going to have to be bigger and longer studies. Let's make sure that we really understand how effective this is. Let's understand how well it is tolerated when we get into bigger clinical trials. And then once we're able to do that, then hopefully we can then bring a new therapeutic to the clinic.